Hi guys, I hope you're having the most beautiful night. I'm pretty tired right now. It's been a long day and a long emotional roller coaster. I've been reading your comments. I'm sorry guys, it's a little bit dark here. I've been reading your comments, and for some people it's still a bit unclear, but some of you get it and can understand the timeline and what's been going on. I don't blame you if it's confusing. Like, now I'm starting to get confused myself, but I have a document here that I think will better explain the timeline of how things went down since I was diagnosed with the dysgerminoma ovarian cancer, the staging, and it also highlights where, when and where the CT scan was done that showed the nodules, and when they lit up, right? You know, at the PET scan, if the nodules light up, then that means evidence of cancer. And then the rest of the results, and then as well, my oncologist's recommendation for the future, or for here on. I'm so tired, guys. Okay, so let's see, where do we begin? I'm gonna show you guys now. Oh, and by the way, thank you so much for all of you that celebrated with me. That truly means a lot to me. You guys are the best, and I truly appreciate you. All right, let me show you guys. All right, so we're here on my chart. Here we are. And this is the information for my last visit, but it actually gives a timeline of what has been happening. So if we go to the beginning, my name, diagnosed with stage 3B, germ cell tumor, dysgerminoma. So again, for those of you who thought that it wasn't cancer, that it was only a cyst, no, it was not only a cyst. It was actually dysgerminoma tumor, ovarian cancer. Dysgerminoma is actually the name of a type of cancer in the germ cell tumor category. So we had the left oophorectomy, amerectomy, sorry if I'm butchering the words again, pelvic and para-orectic lymph node dissections, adhesion in 12/2022. I declined adjuvant chemotherapy. I mean, here it says that I declined it, but it was not really declining what I did. That point was when I met the oncologist for the first time, was that I asked her and I said, wait a minute, why am I getting recommended chemo when I just had surgery and we haven't seen my body, how it looks inside? First, before starting any chemo procedure, I would like to do blood work and have a scan to see what my body looks like inside. But you know, the oncologist explained to me that there could be small microscopic cells that wouldn't be able to be picked up by a scan, or, you know, even be noticeable in blood work. And then that's why it was important to do the chemo. But, you know, I asked for those things, those tests, and thankfully she agreed. So let me read the rest. So what do we have? Okay, so I transferred care to MSK, where recently I had, says she had a CT PET concerning for disease, recurrence with new omental nodules. She presents for follow-up. So I had nodules, right, that appeared at MSK. CT chest pelvis 429 at MSK. So that was the CT scan that I had over there, where they saw peritoneal nodules 1.4 and 1.2, and they said it was previously 0.4, and another nodule that measured 1.3 1 centimeter that previously measured 0.9, 0.7 with trace ascites. And that then there was a PET scan on May 17th, and that there was uptake. So FDG avid peritoneal nodules, for example, left hemipelvic with measured FDG uptake 1.4 centimeters SUV, mid pelvic with misregistered FDG uptake 1.1, 0.7. So they explained to me that when the nodules lit up, that meant that there was cancer, because the liquid was taken in by the nodules. So then after that, I went back to Mount Sinai. I had seen my surgeon, and he recommended a Spanish-speaking oncologist, because prior to that at MSK, I was told that when I was ready for treatment, I could return. Otherwise, I wouldn't be seen there. So my surgeon from Mount Sinai recommended a new oncologist. So then I saw her, but we had a CT scan with her most recently now. Because she was telling me about, you know, how chemo would be important. How chemo would be important for, you know, we're under the impression because of the nodules, right? So we had a CT scan just as we like tried to prepare for possible treatment. And then that's where they said no evidence of recurrent or metastatic disease. Stable exam compared to 214. And the interval events: feeling well, good energy, no fatigue, eating well, no diarrhea, constipation, weight stable, intermittent abdominal pain in the pelvic area, bilateral, no nausea, vomiting. So then we have like more previous information. This started in November. The large pelvic mass, it was 11 centimeters. But when they took it out, it was already 15 centimeters. And then my LDH levels were high. Something else in our timeline over here. I just took away the name of the doctors, so I'm not putting the doctors' names here. Alright, so here we are. Stage 3B, right? Classification. What was examined? On February 2nd, initial visit where a doctor recommended BEP. On 2/14, CT chest and pelvis with NED. And then I had another visit on February 22nd where the doctor at MSK recommended BEP. So that's that, guys. Yeah, and then I met with the doctor at MSK. They did the scan, they found the nodules. Then they saw the nodules lit up. And that's where the doctor told me, you know, you have to do the regimen, you have to do the chemo regimen. And I said, but how are we sure that the nodules are cancerous? Oh yeah, they explained that this type of cancer is very effective with chemo. So it was very good for me to do it. But I asked her, like, how are we sure that it was cancer, the nodules? And she told me due to them lighting up, that's how we were sure. And with my history of the dysgerminoma cancer, again, guys, if I bring you back to the videos, if you guys can remember, I was told initially that I could live 2 to 3 years without chemo and 4 to 5 years with chemo. And then, you know, one of my latest visits, which I believe my friend was there, the doctor at MSK has said that within 1 year, I would be gone if I don't do the chemo. My friend was there. We're going to do a video together to explain to you guys that. and many other things that seem confusing here. I don't blame you guys. It's a lot to take in. It's a lot to take in for me. I can imagine for you, but guys, imagine for me. I'm the one who has lived all of this. You know, it's not easy, but I've had my faith and courage in God, and I've been doing the best I can here as a mom to my girls, and continuing here and just sharing my story. And so happy to hear that I've been able to inspire and motivate people here. It's really amazing to me. So that's what happened. That was a lot of information. If you guys have to take a moment and pause, and you know. But the very last part that I wanted to share with you guys was, you know, my doctor's recommendation for the future. And evidently they told me it was stage 4. And it was stage 4 because the cancer had returned in the form of those 2 nodules that they saw in MSK. I was not aware, like, in all of this and all the information that I get from doctors, that when it returns to a different place, it's automatically stage 4. This is something I just learned recently. I was under the impression throughout this whole time that I am that I was stage 3. I didn't know it changes when nodules appear. I didn't know it changes to stage 4. But apparently, if cancer returns in a different area, which for me, the first area was the ovary, but being that they saw the 2 nodules on the stomach lining, that would make it a different area. So that would make it stage 4 because it returned and it was in a different area. Or the fact that it returned at all, I think she mentioned that means stage 4. So this is what they told me. And at that point, they explained that, you know, chemo wouldn't be for curing. It would be just for treating and to extend your life. You know, to extend your life as many years as possible. I thank God that we did a CT scan before, like, putting a port on my chest before starting treatment. I'm not even sure how we got to the idea of, like, I think the oncologist, thank you so much. Not quite sure how we got to that idea of, like, doing a scan before treatment. I think the doctor mentioned that before starting treatment, you have to have baselines. So I guess this might have been like a baseline test. But I thank God that these baseline tests exist because, you know, I thank God that I didn't put the port, and before this test, that clearly is great news. So this oncologist is amazing, and I thank God for her work and what she has done. And thank the Lord Jesus Christ. Praise the Lord. So there's an assessment plan for me. I'm gonna show you guys that. What's coming up. Like, by the way, guys, this is very personal, and I don't promise you guys that I'll get this personal ever again. But I just felt like I owed it to the people that truly are here for me and truly are here to learn about this cancer healing journey and about my experience being diagnosed with cancer, stage 3 ovarian cancer, dysgerminoma, and then being told stage 4 because of the nodules that appeared at MSK, and having to process and go through that and have that emotional stress in my mind and my body, and like feeling and hearing that I had very little to live and thinking that I wouldn't be here for my daughters. That's a lot. And I remind myself and I remind you guys, I've had the courage to share that here with you all. And the fact that some of you here like think that is nothing, that is a lot to have done that. Like, I seriously, and like, don't promise you guys I'll get this personal ever again, but I hope that my efforts in doing this is something that is appreciated, because it's definitely not something I had to do. But I'll show you guys the assessment plans, and where it clearly states stage 4, and this is what I was told. So again, we have the assessment plan, my name, LaRuby, germ cell tumor, this germinoma. Then it says the different things that were done on December, transferring to MSK, where I had the CT, PT, the CT and PET scan concerning for disease recurrence with new omental nodules. She presents for follow-up. She underwent a repeat CT in July 7th, which did not show evidence of recurrent or metastatic disease. Results were discussed with the patient in detail. I explained that the disease is difficult to evaluate in imaging and would recommend to get a PET scan, a PET CT, and to also bring a disc with her last images from MSK for comparison. Clearly, recurrent, stage 4, germ cell tumor dysgerminoma, stage 4. May I repeat again, stage 4. For those that, you know, began to accuse me first, oh, she never had cancer, she looks too healthy. Secondly, oh, now oh, she looks too happy too, because, oh, God forbid a cancer patient is happy. And then accusing me of never have been told stage 4. Some of you should really be ashamed of yourselves. Sorry, but you should be. Pray to God, and I wish you a lot of love and light. Seriously, I wish you a lot of love, a lot of forgiveness and peace in your hearts. Let me continue with the reading. So CT, July 7th. No evidence of disease. Requested to bring prior images from MSK, CT, and PET for comparison. The PET ordered, the PET scan, and I returned to the clinic in 6 weeks. So there you have it, guys. That's a timeline of what has happened. That's what's coming up. That's the assessment plan. And will anybody be still not happy with seeing it all on paper? I sure hope not, because it's all there. And I don't like to do these things of like showing proof to prove to people or anything like that. Like, that's not what my channel is about. But I put myself in your shoes and some of you guys, and I truly see a need to like understand, because this journey has been tough and overwhelming and confusing, and I'm giving, you know, the benefit of the doubt that people, and for, you know, for my lovely subscribers, that I'm giving you guys, you know, for those that just wanted more clarity, I'm giving the benefit of the doubt that this is the clarity that you guys needed to understand my cancer journey. That's why, you know, I showed you guys and I did this detail in this video. Because clearly, stage 3B, it was a malignant tumor. Clearly, it should have been understood, you know, that it was malignant because it's called dysgerminoma. There's no benign tumors that are called dysgerminoma benign tumor. It's called dysgerminoma because that's the name of a cancerous tumor, guys. But I don't blame you. You know, none of us here are doctors, so yeah, I guess you guys didn't know that. And then it went to stage 4 because of the CT and PET scan results from MSK that stated that I had those 2 nodules that consequently did light up at a PET scan, making me stage 4. We didn't quite know this or understand this, you know, at the moments that it was happening. But then I found out, and then I told you guys. So that is that. That is the most clear timeline you guys will ever get from me, because that's it. I'm done. I'm done. I'm done. I'm done. I am done. I am done. What's the point of a channel if you just can't, like, express yourself and believe in your subscribers and your subscribers to believe in you? Like, where's the beauty of life and love and healing? Come on, guys. Anyways, I love you guys very much. Thank you so much for all your support, your love, your care, and your celebration of this great news. I hope this clears everything. I thank all the oncologists in the world and all the oncologists that have seen me and that have been patient with me throughout all this journey and still continue to be. And hospitals are there, you know, to help us. Oncologists are there to help us. And I'm grateful for I've been seen throughout this time. And I've been monitored. I haven't been left out, like, to not know what's going on with my body. So I truly appreciate that. And I want to thank God for the courage He has given me in this insane situation of a cancer diagnosis. And I want to thank you all for all the prayers that you have done for me. That's beautiful. I truly, truly appreciate and love you guys. Thank you so much, guys. I hope you guys have the most beautiful night and the most beautiful, beautiful weekend. See you soon. Bye.